Thank you. Thank you so much, sir. Good morning, everyone. Good morning from India. Namaskar from India. And this is Dr. Priyanka Rishi. And
Morning,
sir, it's always an honor to be associated with Dr. Imam. I really thank the complete team of Dr. Imam, the institutes, and all the dear students for having me as a speaker for today. It's an honor, again, to be among all of you and sharing my views on musculoskeletal disorders and ergonomics. So before I start with my topic, again, I would like to thank and convey my regards to the entire team for organizing such a beautiful series of webinars, and for which I am also contributing a bit of myself. And so not taking much of your time, I'll be starting with my topic. I'll be just sharing my screen. Is my screen visible, sir?
Yes.
Okay. Okay. So starting with work-related musculoskeletal disorders and ergonomics, today we'll be talking about the musculoskeletal disorders and the most important thing, how can we prevent it or how can we manage it with the help of ergonomics. Before that, let me show you my campus where I work. This is my campus, SGT University. I am associated here since 2014. And here we are working more into clinical research. We are into a lot of research which we are carrying upon, and my area of interest being the musculoskeletal and the women health. My PhD is also in women health, where I am about to submit my PhD in women health. So we encourage a lot of such stuff in our campus. Now, moving on to the topic, the musculoskeletal system, as we are all aware of, that when we talk about muscular system, as the name shows, it is a combination of muscles as well as the skeletal system. So it is a locomotive system. The way we walk, talk, anything we do, the complete locomotion is responsible or is taken care by our musculoskeletal system. It is widely divided into two systems, that is the muscular and skeletal. So as the name suggests, muscular means the muscles. I am speaking, I am talking, I am winking my eyes, I am smiling. This all is contributed by my muscles. And my bone, the way I walk, the way they articulate, the way they move, the way they make my joints move is all taken care by my skeletal system. So when we talk about musculoskeletal disorder, when we talk about musculoskeletal disorders, any injury, any kind of disorders which are found in the human system, be it the muscles, tendons, ligament, blood vessels, all this contributes to the musculoskeletal disorders. As I've just briefed, that musculoskeletal is all about the muscular work. And believe me, this has become a global issue. Everywhere, be it India, be it your country, be it any place, the musculoskeletal problems are increasing at a wider rate, being our lifestyle patterns, the occupation patterns, as Dr. Subbu just briefed about the psychosocial status. So everything, all this stress, all these work-related environments is creating more and more of musculoskeletal disorders. Although we understand that this is not an acute injury, it rather leads to a chronic disease, because at the initial stages, such conditions are ignored. We don't tend to see the clinical practitioners. We try to avoid it, thinking that this will go off. But again, it leads to the muscular imbalance, which makes it as a chronic disease. When we talk about musculoskeletal disorders, mostly it is associated with the manual task. For example, lifting, working, taking the wrong mechanics, all these factors are responsible, which leads to the musculoskeletal disorders. The source of the main reason, the main problem which leads these patients to us is the pain, the injured person's disadvantages. They are unable to perform well, as again just briefed by my fellow speaker. There are certain substantial burdens on the societies for which all these problems contribute and increases their risk for getting musculoskeletal disorders. The statistics suggest that around 30% of the occupational injuries are musculoskeletal injuries that are associated with the manual tasks. The World Health Organization has actually recognized the impact what these work-related disorders are causing onto the human beings or to us, making us more vulnerable to various risk factors. The presence of these risk factors produces increase in the occurrence of these injuries. And because of these injuries, they hamper the personal activities, they hamper our daily activities, they increase the stress level, and all these things together contribute towards our mental health as well. These types of tissue injuries are all soft tissue injuries and are also named by various names. We also call them as repetitive strain injuries, motion injuries, trauma disorders. They have multiple names. Although now the research says that the term like repetitive strain injuries is not considered much because it is not only the repetitive movements which causes the musculoskeletal disorders, but there are various psychomotor as well as psychosocial factors, which we will just discuss, that contribute to the musculoskeletal disorders. These are very common musculoskeletal disorders. For example, tendinitis, again, it is a very common, we call it as a repetitive injury, be it lateral epicondylitis, be it medial epicondylitis. Again, this is again a very common musculoskeletal disorder, which is observed in day-to-day life. Trigger finger, thoracic outlet syndrome, decal vein syndrome, the repetitive motion working on the keyboards, working on the computers, can all again lifting up heavy things, all can contribute. And then back pain, one of the major reasons, one of the major problem, a wide term for that is back pain. Numerous mechanical disorders, mechanical problems leads to such problems. Carpal tunnel syndrome, again, a very common musculoskeletal disorder. These are few again disorders which can be observed. For example, when we talk about the tendon and sheaths on the shoulder, we can find shoulder tendinitis, epicondylitis, decal veins, hip and thigh piriformis syndrome. So these are all various kind of musculoskeletal disorders which have become very common and can be seen into the daily practices. Various occupational risk factors like tendinitis. Why do we call it as occupational risk factors? Again, because there is repetitive wrist motions, repetitive shoulder motions, which is happening. For example, if I am a computer professional or I'm a professor here working on lots of time on my research, working on my keyboard all the time. So there is repetitive typing movements which is happening at my wrist, and because of which the certain injuries, certain chances, I am getting more prone to this, to develop such kind of problems. There are certain few facts, as I just told you. An average person takes around 50,000 to 2 lakhs keystrokes a day. Overexertion and falls are the most common causes for any workplaces and injuries. An average of 1,25,000 back injuries because of improper lifting. As I just briefed you, that biomechanical factors, wrong lifting techniques are all the common reasons which causes such problems. All these activities causes micro traumas, which eventually grows and develops and makes it chronic. This was again a stats which shows that there are multiple occupations which are affected by these musculoskeletal disorders, nursing being the highest, again because the nursing professionals are involved in lifting of the patients, transferring the patients, providing the daily care activities to those patients, and if not managed properly, if the mechanics is not taken into consideration, they end up with various musculoskeletal disorders, like they end up with back pain, cervical pain, shoulder pain. There are multiple problems. The paramedics being the second most people who are affected by the musculoskeletal disorders. Now, Why these musculoskeletal disorders, why they are considered to be a risk, and how does they affect? The problem main happens is because of the fatigue level. Whenever we do the work, if in case we follow a wrong mechanics while lifting or while carrying out techniques, then our body, our muscles begins to fatigue. And once this fatigue sets up in our body, there happens to be a musculoskeletal imbalance. When I say musculoskeletal imbalance, there can be a lot of fascia tendon, fascia tightness taking place. There can be a lot of things getting involved, which leads to these imbalances. All these imbalance caused can lead to the musculoskeletal disorders. When I talk about these risk factors, we can break it or we can manage it, or at least I would say we can try to prevent it by adopting a good ergonomics. Ergonomics, as we all know, we can associate it with work-related or the individual-related risk factors. You can have a look at this first picture. There is a female working on the system with a bad posture, the spine curved into a C shape, and the other picture shows the correct posture. Long working in this posture will lead us to the musculoskeletal problems. So as it is said that force, repetition, posture, poor work, poor fitness, poor health habits are all the risk factors which causes the musculoskeletal disorders. Now, why ergonomics? Why do you think this ergonomics will help us? Again, the major reason behind this, it reduces the risk of accidents, injuries, any kind of ill health due to poor ergonomics. In my clinical practice, I see a lot of doctors visiting me. I see a lot of surgeons, a lot of dental practitioners, nursing staff coming to the physiotherapy OPD for all these problems. Maybe it is cervical, maybe it is back pain. Again, this is because of the long postures, the wrong mechanics they have followed. And what we do as a physio is we provide them a good ergonomic advice. We tell them the better plans, how to take, how to lift, how to carry on their task. And I have really seen a lot of improvements in my patients when they follow these ergonomics religiously. Whenever we work in an organization, we believe that we should feel better and work smarter. If we are into an organization or the place where we are working under stress, this again will cause us into a lot of musculoskeletal disorders. So physical health, mental health, and social health is very important when we talk about the musculoskeletal disorders. So ergonomics divided from ergo means the work and nomos means the laws. That is the laws of work which contributes to the ergonomics. As we know the definition that ergonomics is the science which deals with our workplace. It analyzes, it creates, it designs our workplace and makes us adaptable to that position by making the required adjustments in our workstations, in our atmosphere, in our psychological status. And it is a better way which makes our work more easier and making us at a lesser risk to get the musculoskeletal disorders. The International Ergonomics Association defines ergonomics as the scientific discipline which is concerned with the understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design. All these problems, again, as I just told you, work-related upper limb disorders, psychological problems, back pain, they're all the ergonomic risk factors. What will be the potential results? Why I should follow these ergonomic advice? What can help us? It will increase my productivity. If I am into my patient care, if myself I am not fit enough, how will I handle my patients? How will I provide them a better care? If I am under a lot of stress, if I am under a lot of tension, which is produced in my muscles, how can I do justice to my patients? So for all these, I need a greater productivity. And that can all be achieved if I follow a good pattern, a care of myself. Heightened morale, reduced compensation for work-induced injuries will all give us better results when we follow these ergonomics clearly. Now, when we say about the objectives, it reduces the physical. Whenever I am involved with the better ergonomics, I follow the ergonomics, it reduces my physical load. It promotes the safety at the workstations, improves the work efficiency, and more important, it improves the quality of life. Being a physio, it becomes our prime focus, our prime motto that we should improve or we should strive to improve the quality of life for our patients. If we achieve this quality of life, we can do a lot justice to our patients and providing a better health in any way, be it psychological, social, stigma, any relation kind of health will bring advantages to our patients. How can we achieve this? We can provide them awareness programs. We can ask them to decrease time to working while they are working on their workstations and we can also work by reducing the fatigue related cost. The fatigue, as we just discussed, that this is the most common reason which creates imbalance and leads to the musculoskeletal disorders. So various workstation designs, postures, organization, equipments, material handling, work environment, all these contributes to the ergonomic factors. As we all know that being a human being, we all are different. Somebody is tall, somebody is short, somebody is fat, somebody is thin. If our requirements are different, then how come the infrastructure, the workstations can be similar? So again, the differences should be taken care of. A person who is short-heighted should have a workstation which should match his criteria. Somebody who's tall, somebody who is having back problems should have a different workstations. So again, there are different sizes and shapes which should be taken consideration to avoid such kind of musculoskeletal disorders. Biologically, we are different. We have to take into consideration while we adopt or assess the patients for ergonomics. Behavioral wise, yes, the job satisfaction, work culture, personal problems. Again, this all also contributes to the various musculoskeletal disorders. Again, the certain medical problems like being into smoking, the research has related that smoking is directly related to musculoskeletal disorders. And this creates the patient at more risk level when it comes to the patient who is more into smoking habits. Lack of physical fitness are also the prime features which leads to the musculoskeletal disorders. Various conditions like lightning, heat, again, which causes the person, the human, into lead disorders. The work activities we should adopt should be taken care of. All kinds of muscular imbalance which comes into action is because of the muscular forces. If we follow a wrong pattern, we encourage the muscular forces being acted in a wronger way. Sometimes it is the universal forces which is acted on the one side of the body, making my body inclined to that side, which again causes the musculoskeletal imbalances. There are few principles which I'll just run upon, like you should always work in the neutral postures. Mechanically, our spine has got a beautiful shape which maintain it a proper S shaped. But we leaning into work, for example, you can see picture. We can see what we do is we lean forward and work on our postures or work on the workstations, which again creates a lot of pressure. So the ideal postures can be, if you have a long standing posture, we can have a stepper. You can see in this picture, We can have a stepper behind us under our foot so that our spine is maintained in the neutral position, which will again help in the forces being disassembled in the various ways. We can sit for a shorter time, then we can make ourselves into half kneeling, then we can go into complete standing positions, working in the better position so that there is reduced stress and reduced muscle work which is happening. This is the most common position we all get into. If we work for the longer hours on the system, we go into a C-shaped pattern. Again, this is a wrong mechanics. Again, during the time of lifting, again, we go into the inverted positions. This is again wrong. We forget the basic biomechanics. Our liver system being the major part, our human liver system, bringing upon the mechanical advantages. So while doing any kind of working activities like lifting or patient care, we should not forget our liver systems, which acts as the mechanical advantages to our human body. At the wrong neck positions, as we all know, the neck acts as the most important kinematic factor. It links the complete kinetic chain. It affects the kinetic chain activities. Any problem with my cervical can hamper my complete biomechanics of the spine. So biomechanics being again the most important factor. So we need to take care while we are working, what is the posture of our neck. Many patients, like I just speak about dentistry, they come to us with the forward head posture. Why? Because while practicing on the dental chair, they assume a position. They are into the position where they are moving their neck into more of flexion, causing them the forward neck posture. Some awkward positions. We are in habit of using our mobile phones fixed into our ear and talking like this. Again, this also creates the awkward position at our neck, creating lots of tension and producing the lot of strain activities, tenderness, trigger points, which again activates the musculoskeletal imbalance. So there's a better way. We can all use earphones. As you can see I'm using my earphones so that I can maintain my neck neutral position to avoid myself to getting into risk for getting musculoskeletal disorders. Again, by using the keypads, mouse pads, we should take care of our wrist. Keeping the wrist into the neutral position again can help us. A proper angulation. Recently with my students, I made a project, a working project, wherein I created a device which is called as a hand cuff. So what we do is, it is a kind of orthotic device. We prescribe that device to our patient. What that device does is it is tied on the wrist, and when the patient is performing, it gives them the alarms that this is the time you should stretch, this is the time you should maintain the position of your wrist. So that device I have already sent for patency, wishing that this is accepted, and if in case this is accepted, we will have a better way to work with our keyboards and the long station workers. Again, as I just told, that maintaining the wrist in the neutral position is very, very important. The principle, while moving the patient, shifting the patients, being a physiotherapist, it is our prime focus, our prime way. We do a lot of transferring. Earlier, I was involved with a lot of spinal injury patients. And believe me, when it comes to spinal injury patients, patient with spinal cord injuries, patient with paraplegia, hemiplegia, it is very difficult when you transfer them, when you mobilize them. And if we don't follow these ergonomics properly, then we are making ourselves more prone to these risk factors. And if we ourselves are not taken care of these things, then we cannot bring lots of changes in our patients. So proper this is very much required. Then again, the next principle we focus on is that we should keep everything in our easy reach. We don't have to go move around here and there to get into things. Again, this will help us to perform better and to move better. Working at proper heights. As I just told you, as Physiologically, we all are different. So why our workstations should be similar? We should also have different stations depending upon the height, the work, the air, the atmosphere we are into. You can just see in this picture, the person who is leaning and working is predisposing himself to multiple disorders, which will again prevail in him. He will end up with back pain. He will end up with these spinal deformities. He will develop the spinal asymmetries, the neck postures, the hand postures. So there are a lot of things which can prevail into him. Then there is another principle that works on the reduction of excessive motions. We should try to reduce the maximum amount of pressure and the motions which are taking place. Then minimize fatigue and static load. The most important principle. As I told you, the fatigue, the major reason behind the fatigue is the imbalance, is not properly utilizing my muscle power, is not properly utilizing the tension in my muscles, be it the active tension in my muscles, be it the passive tension in my muscles, the static load bearing. For example, if we talk about shoulder joint, you all know the static loading, my glenohumeral joint, my rotator cuff muscles, my biceps. So everything needs to be properly managed when I can take care of the fatigue which gets into the body system and leads to the musculoskeletal disorders. Then minimizing the pressure points, as I just told you, when our body or muscles get into a lot of fatigue, there are various trigger points which get into, and all of these will create more pressure points, which are called as the contact stress areas, and will hamper the activities of the daily living, will hamper the productivity of an individual, which will affect the patient care. So all these factors can be taken care of when we are providing our ergonomic care. Then provide clearance. Whenever we talk about, we should have a clearance when we move out of our workstations, so that we don't bump into various things and we become prone to falling again and again. We make ourselves injured again. So there should be proper space for everything. While I am sitting, and if I am bumping, for example, I'm sitting and I'm bumping into my workstation again and again because of there is less space, there is no clearance, then again I become more prone to the bursitis or any kind of knee injuries or any problems which can lead to the chronic problems. Then the main principle, move, exercise, and stretch. Again, it should be the rule, it should be our thumb rule that we should not stick to our place for not more than 45 minutes or 1 hour. After every 1 hour of time, we should take small energy breaks. These energy breaks will help us revive our body, meet our physical demands, reduce the stress level, and we will take the small stretches, workouts, and all these which will help us to move our body and stretch our body, which will make us less prone to getting involved into disorders. So these are basic stretches which we can teach our patients. We can teach various professionals, the workstations, various things we can incorporate, and we can make this as a routine that we follow these stretches religiously. Then again, maintain a comfortable environment. Again, this is very important. Environment which is full of stress will create a lot of problems. If we have a bad lighting issues, if we don't have a good connectivity, all this will bring on stress and make our environment uncomfortable, making more prone to the musculoskeletal disorders. So again, as I told you, there are numerous risk factors we just discussed. So there are basic classifications, like we term it as CTD, that is the cumulative trauma disorders. This develops gradually. Again, as I just mentioned initially, we ignore it at the initial stages. And then later on, when we turn into chronic, we end up to our physicians, to our physiotherapists, to this paramedical staff, so that they can help us. So it is better that we take care of all these things at an initial level itself. The trauma which can happen from stress, as I told you, then disorders, any kind of physical impairment, abnormal conditions can all lead to various kinds of disorders. Tendon disorders, nerve disorders, neurovascular disorders, very common. As just in the starting, we discussed about compression syndrome, carpal tunnel syndrome. We talked about thoracic tunnel syndrome, thoracic outlet syndrome. We talked about tendinitis. So all these are the most common examples of these CTDs. Then type of injuries, as I just briefed, there can be muscular pain, there can be joint pain, swelling, numbness, restricted motion again, and multiple things. Strains and sprains again being very common, which leads us to the various problems, back pain, leg pain, any kind of issues. Then contact stress, awkward postures, static loading, repetition force, they are all the major risk factors which makes the major of the musculoskeletal disorders. Then you can see the 70%, this is the stats which shows which area is the primarily affected. 70% patients report the lower back is the major reason. 46% claim the knee to be the secondary most common reason. 43% with wrist pain and hand pain, and 42% describe report pain in the shoulder and necks. So again, I have repeated this. I have told many times that body mechanics is to be taken care of. Proper lifting techniques, exercise, stretching, improved postures will all help us to achieve a good, healthy life and will prevent us from getting into musculoskeletal disorders. So again, this will improve the quality of work, it will improve the safety, and it will decrease the work-related musculoskeletal disorders, it will decrease the fatigue level, and it will decrease the errors. Then neutral posture, as we just discussed, the spine should be taken care of. We should try to maintain the position of the spine so that we don't get into a lot of trouble and don't make our spine look as a wicked spine. We want our spine to be a healthy spine, not a wicked spine, which will lead us into various problems. Then posture is the key. A bad posture will bring us a lot of problems. So a better way, keeping our back straight, keeping our neck neutral, keeping our knees bent with a proper 90-degree angulation will help us in attaining a good posture. Then this is a neutral position which we should take care of. We should avoid such leaning postures, moving on to the front of the screen and adapting into the various neuromuscular problems. Correct body mechanics whenever we are looking, be patient lifting, patient transferring, we should take care of the correct body mechanics, taking care of our liver system, incorrect and correct techniques which will be followed. And the 2020 rule, this will be the takeaway home message from my today's lecture. That is the 2020 rule. We should all practice this rule into our practice. That is, every 20 minutes, we need a 20-second break. These breaks, we call it as breaks, which we require. And then look 20 feet away. We don't have to confine ourselves to our workstation. We need to make ourselves elaborative. We need to make ourselves move away. We need to stretch. And most important, the breathing exercises. As Dr. Subbu just said, that we need to release our stress. We need to work more on the stress so that our performance can enhance. So yes, the more of breathing exercises, the Jacobson techniques will all help us to breathe and relieve ourselves from this stress. So these are various advantages which we just discussed. Before I end my lecture, I would just like to summarize my lecture through this video. It's a small video which will tell you about the bad ergonomics. I just want everybody of you to have a look at this video and you all will be happy to summarize what all we have discussed in this. I'll just play my video. We all can see this bad posture which we just discussed, the way she is working on the keyboard, And this is the creating lot of what? Back cervical problems, ankle problems, knee problems. And now just see how we can correct this. Have all seen this. What we have done is we created a back support so we can keep our spine straight. We created a lap support so that the keyboard is in the front of the eye level, and we have maintained the 90-degree position at the knee level, helping the correct posture. So this was we have made again the elbow and wrist at a 90-degree so that we don't move our wrist at a very repetitive rate. We have provided the back support, we have provided leg support. We tried to bring the laptop in the front of the eye level by placing some book structure, a pile up of books. The more of excessive sunlight also creates a lot of stress. So we created this banner so that we could restrict the maximum amount of light which was entering. So I guess you all could understand what I was trying to explain through this video, that all these factors are very important whenever we talk about the ergonomic cares. We are very much prone. When we get into some work, we forget to work, we forget to take small breaks. We get into wrong postures. So all these can be avoided if we are looking towards a better health, and if we are trying to work into a more healthy and better environment for us. So with this, I finish up my lecture. I wrap up my lecture. Thank you so much. Hope I was able to clear. Although this is a very big umbrella, you need lots of hours to complete this. So I tried that I could inculcate every small bits, so I can bring a lot and lot onto the table to help our dear students, whoever are listening to me. So I'm open for the questions, if any case you have any questions.
Okay, Dr. Priyanka. So I will read the question from the room Zoom. First,
Yes,
is from Dr. Devi. Honorable Dr. Priyanka, how to manage pain, fatigue in patient with abnormal vertebrae shape? My mom.
Sir, I didn't get your question, sir.
Okay. Yes, all suffer from scoliosis, kyphosis, and recurrent lumbar fracture because he suffered osteoporosis. Every day she complained of pain and fatigue on her vertebra. Thank you. Okay, please, Priyanka, Dr. Priyanka.
Okay, sir, if we talk, if we talk about various spinal deformities, like you just mentioned about scoliosis and kyphosis, what the earlier identification of spinal problems is very important. Once we get into, when we talk about we have to take care of the scoliosis, what we can do is we can just manage them. We can provide the conservatively things, like we can help them with the braces, we can help with the various kind of changes. We can ask them to be into the neutral positions. They can so that they don't hamper the progression of the curve, and all that things can be taken care of. Although when we talk about ergonomics, the major problem with this scoliosis is the musculoskeletal imbalance which gets in because of the lateral curvature of the spine. What happens is we get ourselves into wrong mechanics. We go into the compensatory mechanics with the uneven shoulders and all these uneven hip level, pressure levels. So this leads to the various musculoskeletal disorders again. And patient comes to us with the pain and various kind of diseases. If we talk about osteoporosis, as you just mentioned, in the patient with scoliosis, in that cases, we cannot go with a lot of heavy works because of osteoporosis, because we term it as the degenerative scoliosis, which is taking place because of this osteoporosis. So what we can do is we can provide them, we can help them with good exercise protocol, which will include the lot of exercises like the basic stretching exercises, the strengthening protocols. We can work on more of their balance, the coordination activities, and take care of the muscular imbalance, which will help in prevention of the further diseases.
Okay. Dr. Priyanka, one more question from Dr. Ahmad Kuko from
Yes,
Universitas Muhammadiyah. He asked you, if we have a big body or a lot of striking fat, our body will curve themselves to comfort position, and it can cause problematic on vertebrae.
So can you try, actually, can you,
what is the best choice for that, and is this the ergonomic posture to that our body want to, we can change that? Thanks.
Sir, I would just request if you can translate it in English, if you can write me in English, because I am trying to translate it through Google. I can just read one question which is mentioned in English. It is easier for me to, comprehend this. One of my student or fellow mate has asked, how can we easily describe the 10 principles which we just discussed? So I would like to answer that question. In that thing, see, when we have to advise our patients these principles, the main reason, the main thing is the assessment. Once we are done with the assessment, we know what is required in my patient. For example, if I have a patient who is from the nursing staff, and I know while nursing people have more of the lifting patients, they transfer the patients. Now I know that I need to tell my patient that he should take care of while he is working on the patients in the lifting. So I will focus more on the principle of lifting, and that is the proper biomechanics. I will teach my patient how he can use the proper mechanics of my body. So it is not mandatory that I have to teach all 10 principles to my patient. The only principle which is more important to that patient, which I came to know through the assessment, I will work more on that. Right?
Okay. Yes. Okay, Dr. Priyanka, I think if there any question, they will ask by the right, and I will send to you. Okay. Okay.
Sure, sir. I'm happy. I can answer all the questions, and you can just text me. I'll drop my email. You have my mail ID, sir. You can ask me there. I can pop me questions, and I'm happy to answer all the questions.
Okay, thank you. So that's why because the time is over now, so I'm as a moderator and also as a team to say thank you for your lecture, and for this, I will appreciate you and your university to help us in any way for online lecture like this, and another way maybe teaching the student and other. So I will back to the ceremonial team. Please, Dr. Devi, the closing for the this event.
Thank you very much.